Hi there.
Hello.
How many people are usually on these things?
I've only done one other one, and I think we had maybe 3 people log on. Not a lot. I think maybe more people, hopefully more people watch the recording. So
Your hair looks pretty.
thank you. My kids' school was 2 hours late today, so I had extra time in the morning to do, frivolous things like curl my hair.
That's why I'm home. Ours was
Avoid
2 hours
my-
late. Ours was 2 hours late, and I was like, I'm just gonna start work and stay at home. So, and then of course people are at my office looking for me, and I'm like, where were you yesterday?
I'm excited for this topic. I hope we get lots of people logging on. Well, we can wait for everyone to get
Can you
ready.
guys hear me okay?
Wait a few minutes here.
Good morning. Can you guys hear me okay?
Yeah, we can.
Okay.
I'm glad you
I
joined.
had all kinds of weird computer things today.
Give it just a couple more minutes and we'll get started.
Joey, your topic is super timely today as my oldest is having a super rough day. She struggles mightily with some depression, and seasonal is really hard for her, and today's a really rough day for her. And I was like, wow, appropriate day, I guess.
Yeah, my daughter struggles too, and COVID-19, the shutdown was really hard on her. So I think a lot of kids are struggling right now, and it's so timely. I mean, the Surgeon General came out last week, so this is something we can all use a little bit more information, even if you don't have children. I think we all deal with children on some level. So
yeah, husband, I get that. What? Sorry.
and we have to remember we were all children at one time. So whatever affected our mental health as children affects us today. So, which as parents makes you even more anxious because then you think, oh, everything I'm doing today is affecting my child. So.
All right, you ready, Joey? All right. For those of you that don't know Joey, she is a member at our gym, and she's worked in both the healthcare research and nursing for the past 20 years. She has a bachelor's degree, which I did not know, in animal science, and nursing is on her last semester to obtain her doctorate in nurse practitioner, right? She has also over 200 hours registered yoga teacher because she teaches yoga for us, and has been an athlete since 2017. For the past 4 years, she's worked specifically with children in the pediatric ICU with direct care of children. She believes in the integration of mental and physical health for the prevention of chronic illness. Take it away, Joey.
Well, thank you. Thanks for introducing me, Jenny. Jenny is my coach, and I appreciate her every day and every text message she sends me. So I am so blessed that I am able to talk to you today about this important topic. Pediatric mental health has been at the forefront of the news and in the medical field. Certainly, this was an issue prior to the pandemic, and children's mental health has been negatively impacted by COVID-19 and you know, the mitigation strategies related to that. So let me start by presenting a little bit, just a quick PowerPoint to give you an idea of the topic today. Oh, Jenny, do you just want to give me, so I can share my screen? I'm not sure how you do that, but, oh, there. Okay. Okay, as you guys know, we are talking about pediatric mental health. We're going to talk about the identification and treatment of it. Little overview, you know, what is childhood mental health? How are children different? The causes of mental illness, mental health treatments, and mental health beyond medicine. So when we talk about childhood mental health, we often think about mental health illness. When someone says, you know, mental health, we automatically turn to the negative of that. But we need to remember that mental health, especially for children, is the ability of these children to reach developmental and emotional milestones, in addition to learning social skills and problem solving. The children develop their mental and emotional skills at this age in order for them to become productive adults. And as the adults in the room, we need to be able to identify problems with these children not meeting milestones and then intervene before it becomes a problem. So Kate Middleton has a nice little quote here. It says, a child's mental health is just as important as their physical health and deserves the same quality of support. EHP is an amazing facility, and we're, you know, as much as we incorporate physical health, we want to make sure that we are paying attention to our mental health and how our physical and mental health work together. So common pediatric mental health diagnoses. So I've just listed a few of the common ones, and the ones that are in red, anxiety, depression, and attention deficit hyperactivity disorder, are the three most common diagnoses in children. Other diagnoses, though, that are very common: oppositional defiant disorder, conduct disorder, Tourette's syndrome, obsessive compulsive disorder, and post-traumatic stress disorder. Those are all very common as well in children. It's important to also remember that these diagnoses, just like in adults, don't happen just one at a time. There's often an overlapping of these diagnoses. So anxiety is by far the most diagnosed mental illness in children in the United States. 7.1% of children in 2019 were diagnosed with anxiety disorder. That's 4.4 million. Depression, nearly half as many children have depression in this country, 3.2% of children between the ages of 3 and 17. And ADHD, 6.1 million, or 9.4. I guess I should say ADHD is the most common, but so 3 to 17 years old, 6.1 million. these are all tend to be chronic conditions. So when we think of children with type 1 diabetes, children with hypothyroid, conditions like that, those are chronic illnesses. These children will likely deal with mental illness into their adulthood when they are diagnosed as children. So what do we see in children, and what are the signs that we're looking for? So anxiety, children with anxiety often have worry, fear, phobias, panic, and irritability. As many of you parents know, this can these things can happen not if the child has anxiety. So children can have worries and fears. That's normal for them. It's normal for them to have separation anxiety as infants. It's normal for them to have fears of bodily harm in their school-age children. Those are normal reactions. But when the children have irrational fears or worry about many things or phobias that are not realistic, and then if they include physical symptoms such as stomach aches, headaches, fatigue, those are the times when we begin to worry or to begin to need to assess whether the anxiety has become a problem for that child. Depression in children, as well as really most mental health illness, it depends on the age of the children, because as the child develops, the symptoms will look a little bit different. Depression can present as a child feeling sad, hopeless, also irritable. This can manifest in poor appetite, changes in sleeping patterns, energy levels, self-destructive and self-injury behaviors. We often see this in teenagers. So as I said, school-age children are, the elementary school-age children are often afraid of bodily harm, but teenagers begin to get into self-injurious behaviors as they get a little bit older. Risk for suicide. Suicide is one of the leading causes of death among people aged 10 to 24. We'll talk a little bit more about suicide in a little bit. So ADHD. So as you know, this diagnosis, as we talked about, is attention deficit hyperactivity disorder. So as a whole, that's a combined presentation. That means that the symptoms of both the inattentiveness and the hyperactivity impulsivity have been present for more than 6 months. The reason they put that 6-month thing on there is because, as we know, teenagers, as they grow, as they are learning to deal with their environments, changes in their environments, we want to give them enough time to be able to diagnose this as a problem over time and not a situational issue. So there is also predominantly these split up. So inattention but not hyperactivity has been, if that's been present for 6 months, or just the hyperactivity impulsivity. So, if you see this in your child and you're like, yeah, but they're not really inattentive, they're just impulsive, that still would constitute as an ADHD diagnosis. So how do we treat anxiety and depression? So I've left ADHD out of this for just a moment because anxiety and depression are often treated in children much the same way. So in adults, from a medical perspective, anxiety and depression, the first line of treatment is often SSRIs, or your serotonin receptor uptake inhibitors. And in children, that's not the first line of therapy. The reason for that, in part, is researching medications in the pediatric population is very controversial. So while we have a lot of data retrospectively in children, because SSRIs have been used in children for over 20 years, or probably over 30 years now. So we have a lot of data on it, but putting children on medications when we can intervene at an early enough age to help that growing brain understand how to interact with their environment. Cognitive behavior therapy is just the gold standard. It's where we go first. So that means they're going to be meeting with a therapist. They're going to be talking about how they interact with their environment. How do they deal with their friends at school? How do they deal with social media? And then what is going to be the best way for them to go forward with that? Treating ADHD is a little bit different. ADHD, while behavior therapy, which is very similar to cognitive behavioral therapy, only really deals more with behavior and the behaviors that exist because of the ADHD, is common and can also be used for anxiety and depression. But the child behavior therapy is really for the child. Because of the behavior issues that present with ADHD, parent training is also considered a first line therapy. So parents become trained in learning how to monitor that behavior and how to intervene. So this helps children with ADHD succeed at school, home, and in relationships. So alternative treatments. So between therapy and medications, we also want to talk about diet and exercise. As we know from a medical fitness facility, we know how important diet and exercise is to the children. So there, quite frankly, is also not a lot of really good research out there regarding the effects of exercise and diet on children and mental health. However, I found two amazing systematic reviews. So systematic reviews, when we're talking about research, those are like the pinnacle. Those take and look at other studies that have been done and say, okay, we collected all these studies, we look at all these studies, and what's the overall theory on that? So systematic review by O'Neill in 2014 found that for sure diet and mental health were linked. Children with poor diets tended to have unhealthy mental health, and children with good quality diets had better mental health. So there's just that importance of that relationship between dietary patterns and mental health. Exercise was a little bit harder. There is one really good study out there from Marker et al. From, looking for the date, 2018. It talks about exercise and mental health. It did find that the quality of life increased with, health-related quality of life increased with exercise. Regardless of these small the lack of evidence, there is good correlation between these. And we already know that exercise has neurobiological and psychosocial factors with it that are important. And we understand that diet can make us all feel better and worse depending on what it is. As I mentioned before, medication is also an important intervention. You know, if we've failed at cognitive behavior therapy and we've failed at, if exercise and diet hasn't improved the patient's condition, then medication using SSRIs may help the individual. Now, clinical trials that have compared SSRIs to cognitive behavioral therapy have yielded mixed results. So it's important to look at the child and what that child needs individually. I alluded to COVID-19 and mental health. There's limited data on this currently because studies are often retrospective in children, so that we're not, we're not using children in current studies. We're looking back at the data to see how it is. So there's little data out there currently on how COVID-19 has affected mental health. But as I and all my colleagues have seen, I work in the pediatric ICU, we have seen an increase of self-harm, we've seen an increase of children with behavioral issues. One of my colleagues that works in the eating disorders clinic said that she has seen an increase in children there. So we see it as healthcare professionals. I just can't give you hard data on it right now. I can give you a little bit of data pre-COVID. So why these numbers are this way is hard to say, but self-harm amongst girls ages 13 to 16, they're at the greatest risk in this self-harm. So we talked about how elementary school children are often afraid of hurting themselves. But once you get to this age, this pubescent age, 13 to 16, and especially girls, they're the greatest risk for the self-harm. And what I mean by self-harm is things that aren't necessarily suicidal in nature, but it may be cutting, it may be anorexia or bulimia, it may be other self-harm things. We do really see cutting as one of the greatest. So as you notice on this incidence, boys, really, this hasn't changed much, but girls, there's clearly an elevation in self-harm starting in about 2012. And, definitely the effects of social media on girls has been at the forefront of news and research as well. We know that that social media can have a negative impact on how girls see themselves. And so I can only draw the correlation between social media and the numbers here, but it's an interesting topic that needs more research. And I think, we need to, as parents, consider the amount of social media exposure our children have and how they use social media. So suicide is by far a problem amongst our young. Suicide is the second leading cause of death in the US among individuals aged 10 to 34. So that statistic comes from the National Institutes of Medicine. And these numbers are from 2019. In 2019, 47,511 youth up to age 34. We include those up to age 34 in this number, but that's a large number for suicides in the United States. Suicide is only second to trauma, car accidents, things like that. So the number of children and adolescents aged 10 to 24 that died by suicide in 2019. So that just takes out those 24 to 34 was 6,488. So suicide prevention. Suicide prevention is not just for the patient or the child or someone who is thinking about suicide. This suicide prevention number, I want to just emphasize that this can be made by someone if I'm concerned about a friend, or if I'm concerned about a loved one, or I want everyone to know this number. I want children to know this number, that this is 24/7 and it's completely confidential. So the 1-800-273-TALK or 8255, that is the number to call. So health promotion and mental illness prevention. So preventing mental illness. So how do we prevent these children from getting in this place to begin with? Unfortunately, as I continue to say, there are very few high quality studies that show the best methods for preventing mental illness. We know that mental illness is a multifactorial problem: relationships, family dynamics, socioeconomic factors, diet and exercise. And so the only way that we can prevent mental illness in children is early interventions, identifying that mental illness as soon as it's possible so that we can help children with their relationships and their activities before it begins to affect their lives. So in conclusion, mental health is important. Mental health and physical health in our children is paramount. Children and young adults' mental health is complex. They are developing their interactions with the world around them at the same time that they are dealing with stressors that we all deal with. And so this juxtapose of growing and learning at the same time they're having to deal with very complex issues makes treating and identifying mental health in young adults and children very difficult. Therapy can be critical for those with a diagnosis. Prevention includes those positive relationships, diet, exercise, social interactions, and then there's so much more to learn. As I've said, there are a few studies that have determined really effective management strategies. And so for now, our effective management strategies really need to be individualized to that child. So we need to start with those gold standards of cognitive behavioral therapy and then determine if medications are warranted or how we can change that child's environment to be conducive. So I'll end my presentation right here. If you have any questions, comments, we'll open that up right now. Here are my references. And I also have 2 other references that I will link later. Those are the 2 systematic reviews on diet and exercise. So, does anyone have any questions?
How much does screen time on phones affect phones, video games, that kind of stuff affect mental health in the kids?
So that's a good question. Again, limited data out there right now, but we know that screen time negatively impacts children's mental health. We know that that it depends on what they're doing online too. We've all spent the last 2 years in front of screens. You know, if you didn't work in front of screens before, you do now. And our children, we put our children in front of screens to learn. And so it also depends highly on what they are doing on that. You know, we worry about social interactions. One thing to note is, as much as we want children to be social, they need to remember that the friends that they have online or the interactions that they have online are not as meaningful and not as productive for their mental health as true interactions. If they're actually meeting with other people, if they're actually playing with other children, having those interpersonal relationships. So current recommendations is to limit screen time to less than 1 hour per day. And of course, in recommendations for exercise is 1 hour per day. So if we can move that needle to decreasing screen time and increasing physical activity time and social interaction between our children, it certainly will be a benefit to them.
Lindsay, you're talking, but you're not coming through.
Unless you're in another meeting. Oh, no.
Is your microphone off? Let's say we heard you just fine earlier.
So I'll also just, until she can get her mic back on.
You can type the question in the chat and we can
type in the chat. So I also wanted to mention, because I mentioned this maybe before the presentation started, and last week the Surgeon General made a national announcement just speaking on this topic of how important children's mental health is. This really, when medical professionals get the guidance coming down from the Surgeon General, it not only puts an awareness to the public and to government leaders, but it also puts the pressure on healthcare professionals to increase our surveillance and our treatment of children's mental health issues. So it's good that he put that statement out there, because I think as a professional that works with children, we definitely have already seen it, and we know that it's an issue. Okay, so Lindsay's question is, do you have any recommendations for therapy references? The FM area is grossly underserved and incredibly hard to find providers. So as you guys know, I'm going to be finishing up my nurse practitioner, my doctorate in April, and I am also out there looking for jobs and or just looking at the market. And there is a special nurse practitioner degree that I don't have. It is a mental health degree, and nurse practitioner mental health. And there are probably 30 openings in the state of North Dakota, scattered out throughout the state. If someone wants to go into that field, you can have all of your student loans paid for. This is how important and how underserved our area is in mental health. This is not a problem, though, that is isolated to North Dakota and to the FM area. This is a national problem. So as we get this guidance from up above, right, that this is a problem and we need to address it, from down below, we're like, we know it's a problem, we know we need to address it, and more money needs to go towards this. So hopefully with this, with more awareness of the problem, we can improve the service to these problems. I think of it as any other problem. If we didn't have enough OBGYNs, or if we didn't have enough, cardiologists in the area, we would all be freaking out. So yes, it's completely hard to get an appointment. It's hard to get your child into therapy. There are plenty, though, of good locations in Fargo that are doing their best. They're trying their hardest. Pediatric Therapy Partners, trying to think of some other independents. Of course, Sanford and Essentia have therapy and have providers that do that. But I agree, it's hard. The Village Family Services is another really good place that can help with therapy. It's definitely something that I think is going to hopefully turn around. I hope that, my hope is that as governments become more aware of the effects of mental health, that we can have more providers working in that area. So, but as a family nurse practitioner, as my training is, I don't specifically work in mental health, but as I have experienced in my clinicals, all nursing, or all medical field is mental health, because we all have mental health. Yes. So my advice for high risk of suicide, if your child would express suicide threat. So this happens, I worked for a long time in a critical access hospital. We would get patients coming in for suicide risk. And that was always really hard, because we were in Minnesota, and if we had to send them somewhere, we had to send them to North Dakota, and there was a border issue. But there's also Prairie St. John's will do a immediate assessment and try to place. They are also overwhelmed. But yeah, I wish I had better answers for you or for everyone on this. But presenting to the emergency room is long, tedious, but necessary if you cannot get in for an evaluation at Prairie St. John's. Now, as with any child or adult that expresses suicidal ideation, until treatment can be obtained, not allowing that child to be alone, not allowing that person to be alone. These are really universal, not just children, but not allowing them to have access to medications. If you have medications in your house, get rid of them if you are not using them. If you use them, keep them in your purse, bring them with you, keep them locked at home. Teenagers are very, very, they're very crafty. So, and they know these medications. Don't be fooled that your child is maybe 9, 10, 11 years old and doesn't know medications. These kids can Google just about anything like you and I can, and they can figure it out. So we do see overdoses of SSRIs. And that's the other thing. So if you have a child who's already on an SSRI and they have access to their own medication, how do you protect them from their own medication? So those are important things to consider if you have a child with a suicidal ideation. So, important things to remember. Just trying to think of other questions. Did I have
You
any?
want to talk about like warning signs for children of different ages?
Yeah, so warning signs are going to be different. I kind of alluded to this earlier. Warning signs in children are going to be different by their different age groups. Children, younger children. So when we talk about mental health, certainly mental health, illness and mental health can happen at ages. I mean, we can diagnose down to age 4, although that's not common, that's not typical. But we need to remember that young of an age is very difficult to assess for depression, anxiety, and ADHD. So at that point, we're just looking at behavior modification, cognitive behavioral therapy, and looking at the environment of that child is in. Children in elementary school age, they are going to have difficulties in school. They are going to be irritable. They're going to have problems with sleep. They're going to have phobias. And then you have your teenagers. They're going to withdraw from things. They're going to withdraw from their friends. They're going to withdraw from their activities. Their grades may be poor and they weren't before. And then of course there's those signs, and then there's the warning signs, and then there's the red flag signs. The red flag signs are they are giving things away. They are not talking to anyone. They are not doing anything. And then eating patterns, if they're eating patterns. So sleep, eating patterns, change in activity, change in friends. Younger kids, they just have more irritable. They're less from withdrawing from things. But certainly a change in any child that lasts more than even a few days. I know, like, we can't make a diagnosis for some of these for 6 months, but a change in a child for 2 weeks is something to be concerned about. And talk to your child. I think that's kind of a we do it and we don't realize how important it is. Like, hey, what's going on with you? Or why are you acting like this? Maybe it needs to be more of what's going on in your life. What is causing you to be so upset? And sometimes it's a normal reaction. Something has happened in their life. They're just not being able to handle it. But remember, these kids, they're going through issues that they have not yet learned how to handle. And if us as parents can't help them get the tools they need to get through these, then we need to seek help to find those tools to get that help. And that's reaching out to teachers, reaching out to, that mental health professional if we can, but definitely reach out, if you can't get, let's just say you have a child with depression and they can't get in to see someone for 6 weeks. Make sure you let that teacher know, that principal know, their music teacher know, like my child is struggling and we need to, be addressing this, and where do you see the problems? Because teachers often see problems that parents don't, is it a problem at school? So that's really important to remember. Oh, great, yes. Like kids will come home and hide stuff from their parents. They don't want their parents to know that they're unhappy. They don't, and they don't want their parents to worry about them. They might think, oh, my parents have enough to worry about. I don't want my mom to worry about this. So children are very, very good at trying to protect us from information too. So when I say they're crafty in the sense of they're way smarter than we think they are. They are. What other topics did I should have pulled up those questions too.
What about less known medical or mental health concerns?
Right, like last known well. Like, so it's important to, like, if you are going to take your child, say you do finally get that appointment and you take your child into that visit, the provider is going to want to know, when was the last time that child was well? Like how long has this been going on? That's important for them to know, because we need to know what was going on in the child's life at that time, and was that an effect of this? So as we all know, mental health can be triggered by things. So we're not saying that things in children's life cause mental illness. Some of us, though, we know there's a genetic component to it. Some of us are more predisposed to mental illness, anxiety, depression, ADHD, but that can be triggered by difficult situations that aren't able to be handled. So it's important to remember that much like other medical diagnoses, mental illness is not just a genetic component and just an environment component. We need to look at the two pieces together. So knowing when that child was last well is important to establish what may have triggered the event that led to the depression, the anxiety, the ADHD. ADHD is a little bit different, and that's why we group anxiety and depression and ADHD a little bit outside of it. But knowing when the child was last well is super important. The other area of study that I think would be an interesting place to look at is how do group activities help. Yes. Lindsay just said that it's to identify triggers before a dip in behavior, and that is really important to, as I've expressed, my daughter is 11. She struggles with depression, anxiety, and often the littlest things, the things that you think, oh, it's not that big of a deal, but if she's had a bad night sleeping, it could make a whole bad day. And as we all know that lack of sleep lowers the threshold we can handle stuff. And in a child, that even becomes more important because they need sleep to grow and develop, and their brain is developing. And then when we interrupt that sleep, then those are those triggers that can cause behavior problems. So yeah, some parents will note excess sugar in their diet. Some parents will note sleep interference, things like that. Of course, there's always do they have a big concert coming up and they need to play a solo? Is that going to cause them excess anxiety and then cause problems in other areas? So, and then being able to identify interventions that work for your child. And that's something that a therapist can help you work through too, is what, if we know that she had a bad night sleeping, what do we do to, how can we cut this short so that I can get her back on track? Do I need to take something out of her day? If she didn't sleep well last night, maybe it's okay for her to skip, band practice. I try not to let her skip any physical activities but sometimes we do. Because I know that makes her happy. And that's the other thing. Sometimes if she doesn't even want to go to swimming, I make her go to swimming and she's so much happier after. So that's my own little scientific study there, but my daughter does really well after having some physical activity and getting out and just being with some other kids. So yeah, I see correlation between siblings. Well, so correlation overall between my own little study. My kids are the yin and yang of children. So I don't see much correlation there, but yes, since there is a genetic component with mental illness, there is certainly, if you have one child that struggles with mental health, it is very likely that you should be watching for signs of mental illness in your other children. We know that mental illness, we know that and like I said, I didn't even expand on all of the mental health issues of children, but we can even correlate alcoholism in older age to mental health in younger age. And we know that alcoholism is just, falls in that genetic category too. If there's a genetic component to alcoholism, there's a genetic component to mental illness. And if those two things are correlated, then yes. Yes. So, definitely it's important to be watching that. I think the greatest thing about living in the world that we are in right now is there is this awareness of mental health. People didn't talk about it 2 generations ago. Think back, we all had that maybe uncle that struggled, or that, or maybe our grandma struggled and nobody talked about it, and nobody, nobody, or they used another term for it. Oh, she was just quiet, or she was a hermit. She didn't talk to anyone. She, things like that. So we didn't have a name for it. We didn't name it. We didn't call it out, and we didn't acknowledge it in people. And I remember one of my best friends from elementary school going on Prozac for the first time, and I was like, oh my gosh, like that's horrible and terrible. And you know what, like it made her, it enabled her to function. And so while it's not for everyone, I think that we are living in an amazing time where we can identify this in children. We can treat it the best we can. More research is needed, of course. We want to know more about it, but yeah, being able to to live in a time where we're aware of it. We also live in a time of social media and COVID isolation. So there's also problems there, but I just realized it's like 12:14. I know that this was like scheduled for 30 minutes, but this is just really good information. Yeah, I think we should, Lindsay wrote, we need to talk about it as common as brushing your teeth. And absolutely, like mental health needs to be one of those things, like, did you check your blood pressure at the last visit? Did you check in with your mental health? Like, we need to ask people, how are you really doing today? Oh, fine. No, like, how are you really doing? Like, and we need to check in with our kids, like know the questions to ask them, and be aware of those subtle changes in them. And I know it's a lot of responsibility as a parent, and you feel like you're out there, no one else is paying attention, but they are. The teachers are paying attention to your children. Your coaches are paying attention to your children. Talk with them. It takes a village. You know, we always hear that it takes a village to raise these kids. It really does. And I think, you know, just to kind of, oh, okay, bye. Just to kind of wrap it up here too, anyway, like I said, I think that the greatest thing about being at a medical fitness facility is knowing the impact of diet and exercise and social interaction on children's well-being and children's mental health. We see it at the gym. We see these children open up. We see them gain confidence, and that is all helpful. We need to intervene when children are having problems. And so I just encourage everyone out there to learn as much as you can about pediatric mental health, to know how to identify it in children, and then how to get help. So, Penny, thank you for having me on today. If anyone has any questions, they can reach out to me. I am on Facebook, I am on Instagram, and I would be willing to talk to anyone about this. I just want to preach for the rest of the day. So, okay.
Thank you, Joey.
Yep. Have a good day, everyone.